and he has blepharospasm, and he underwent a procedure. Do you want to just quickly say in 20 seconds what happened?
I was having trouble with the Botox. It wasn't working well. And I had a surgical procedure, oral surgery with a general anesthesia.
Thank you.
Which, upon awakening, the Botox doesn't, all the symptoms of blepharospasm was gone. Sorry. So, after awakening from the general anesthesia, the blepharospasm symptoms, and I was having a little bit of mage-like type symptoms, both disappeared immediately. And I had realized that in an earlier treatment, I also was having a little trouble getting relief. And I also had a surgical procedure, and within a week, all the symptoms were gone. And I just wanted to mention that to the people here because it was almost like turning a switch the second time. Obviously, it didn't keep the first time, and it may not be.
Dr. Hallett, have you seen this?
So there are sometimes events that either precipitate blepharospasm or help blepharospasm. So some people can. For example, I've heard stories of people being in an auto accident and suddenly blepharospasm comes on, or being in an auto accident and suddenly blepharospasm goes away. And surgery is another very, very dramatic episode that can potentially increase or decrease things, although it is the case that general anesthesia, and you and I have talked about this already in the break earlier, general anesthesia can change a lot of the chemical makeup of the brain temporarily because that's what you have in general anesthesia, and that could reset some of the basic synapses in the brain and could potentially have an influence in that regard. The only way of knowing whether that is really something that helps in general is to know whether other people have had similar types of episodes. And those are the epidemiological facts that then lead us to more types of experiments and thinking about this sort of situation. So no one has ever mentioned that to me before, but we have a lot of people here, so we'll just ask everybody here. Has anyone else experienced improvement of blepharospasm after general anesthesia? Is that something that anyone else has ever noticed? So that seems to be, at least among this particular population, relatively singular. Maybe other people will have experienced it. I don't think there's a clear explanation of that at the moment, but personally, at least I'll keep my ears open and see if we have other people that have that same situation in the future.
Okay, thank you. What factors decide if a patient's a candidate for DBS surgery? Dr. Richardson will cover that this afternoon. Dr. Stefko, how do you determine if you have dry eye versus blepharitis? What should you use if you have blepharitis?
So that's a pretty wide-ranging question. Usually they go together, and there are different types of blepharitis. We usually divide them into anterior blepharitis, which is where you have a lot of debris along the lashes, and there's an overgrowth of staph bacteria, and we try to cut that down by giving people baby shampoo scrubs and sometimes a short course of antibiotic ointment to the lid margins. And then there's also what used to be called posterior blepharitis, which is the meibomian gland disease that we talk about, and many people use those interchangeably. That's when you have a deficiency of how the oil glands in the eyelid work, and those two things are sort of different because the meibomian gland disease can cause the evaporative dryness, and we would approach that the way that we sort of talked about in the talk, with warm compresses and trying to decrease the bacterial load and trying to get those oil glands to thin out, or oil secretions to thin out.
Dr. Evinger, what research is being done in the area of neuroplasticity training in relation to blepharospasm?
Almost none. I mean, really, there aren't that many people working specifically on that. I've done a little bit on it, and Dr. Hallett has done some on it, but there hasn't been much. I mean, the general feeling is, as Dr. Hallett was pointing out, that there's a deficiency of inhibition, which means certain parts of your brain are basically cranked up. And so the neuroplasticity experiments that people have been doing have been trying different ways to sort of turn the volume down on those parts of the brain. And I don't know of any that have been completely successful.
Right, I don't know of any that either. However, there's still more work to be done in this area. There hasn't been a lot of work, so I think more studies could be done. I think the inhibition and the abnormality in plasticity operate together to a certain extent. As Dr. Evinger was saying earlier, that if you have this decreased inhibition and abnormal blink cycle, if you keep on doing it, the abnormal plasticity might in fact sustain it. And I think that's how they could potentially work together. So it may well be possible to turn it around in the other direction, and that's the hope for plasticity therapies, but still we need more work in that area.
Dr. Hallett and Evinger, is there a database where one can collect data on all benign essential blepharospasm patients for things in common which may initiate this disorder? If not, is consideration being done for that?
All right, so I can answer that question. Is there a database of patients who have blepharospasm and putting together different aspects? And there are two main databases that people should in fact know about. One is done by the Dystonia Coalition. This is a group of investigators interested in different types of adult onset focal dystonias, which include blepharospasm. And people can come into the centers where this is operative and get into this particular database. There are standard tests that are done, a videotape is done, and blood is drawn for genetic studies. This is an international effort. It's led by people in the United States, and I hope that many of you register in this particular database. There will be particular projects that will be spun off from this particular database, and hopefully within the next few years there will be a special project focused on blepharospasm, and the patients that are participating will be able to work on this particular database. So this is a very important effort. BEBRF is one of the contributing partners in this Dystonia Coalition database, and if anybody wants any more information about it, I can give you more, BEBRF can give you more about it. There's also a patient registry that is also organized by the lay organizations interested in dystonia, and that particular database is also an international database. People just sign up on their own for that database. It also includes general information about different aspects of medical phenomena in that database. That particular database has a large number of subjects in it. It hasn't been exploited yet for medical purposes. We're hoping that soon that will be open for medical research. It hasn't been opened yet, but it'll be coming shortly.
Can a traumatic event incite or stress incite blepharospasm? I can answer part of that. It certainly can incite tics or Tourette's syndrome, but any stress can exacerbate blepharospasm. But to my knowledge, it's certainly not a cause of blepharospasm. Dr. Hallett and Evinger?
Well, I think that It's not completely clear in that regard. I think it certainly is true, as you say, that stress makes everything worse. So there's nothing really terribly good about stress, and people should try to keep avoiding stress the best you can. It may be one of the multiple factors that contribute to blepharospasm, but exactly how it would do that is not clear.
Okay, and this is the final question, and then we're going to head for lunch. And I'd also just like to say, please, just in the first 20 minutes of lunchtime is when you need to have your parking passes validated. And right before we start our 1 o'clock talk, I would like the speakers, as well as Mary Lou Thompson and the 4 district directors, to come up stage so we can have a quick picture. Last question is, can a myectomy, Dr. Stefko, result in a remission of blepharospasm?
It doesn't so much get rid of the blepharospasm, it gets rid of the end result of it, which is the functional blindness. I haven't heard of people having complete remission where it just goes away completely, but it becomes livable, I guess is the way to put it.
Yeah, I thought that was important for you to emphasize that. Okay. All right, let's have lunch.